What's up, everyone? Do you have back pain or are you trying to get back in the game after back pain? That's exactly what we're going to be covering today. So remember, I'm Dr. Tansini, Dr. Tank, here at Grand Overhead PT. If you haven't done it yet, subscribe to the channel. Make sure you never miss a way to bulletproof your body and be your best self. You're an athlete. You don't want to miss time. These videos are ways which we can make sure that you don't miss time and continue to thrive and perform at your absolute best. Okay, so let's jump into it. Back pain, it sucks. If you're dealing with it, you know it, right? Whether it's you're having trouble doing a deadlift or any kind of just bending over or that hip hinge type movement. Um, if this is the case, right, the way to get better isn't to just avoid doing the hip hinge. If we avoid the hip hinge, you're not only going to set yourself up for more of a chronic back issue, chronic back pain, you're going to be more likely to hurt your back in the future. And on top of that, right, you're going to be weaker. You're not going to perform as well. So if the hinge is something that really scares you, then maybe instead of let's avoid it, let's actually go into and let's start progressively loading it so that we can build confidence and build strength in that hip hinge. So now, one way we're going to do this, and this is something that I use with many of my back pain athletes or athletes who are dealing with back pain, who are a little bit timid to go into that uh, hip hinge, is we're going to use a barbell good morning. Okay. So essentially, barbell good morning. All right. Throw that barbell on the back, and I'll turn a little bit sideways here so you can see me. But you're gonna keep the rib cage down. So a big mistake people make when they do the barbell good morning is they kind of get in this super arched out position. Okay. And yes, they're like, oh yeah, I make sure my back is tight, and I think that's what I'm supposed to do here. But that is training a pretty poor pattern, right? And just throwing you in that provocative position of that lumbar extension. So now, what I'm gonna have you do instead is I'm gonna have you lock down the rib cage in the front. Remember, we want to stay locked in here while we then get the hip hinge from the hip, right? We don't want to be here, right? We want to be ribs down, maintain that rib down. As you go down, you feel the load of the hamstring, stand back up. So ribs down, hip hinge, the spine moving as a unit, down, up. Let's just do one more and then up. Boom. Okay, so yes, with the good morning, right, we're going to train not only the hamstrings, the glutes, but we're also going to train the back. But we want to do it in a way in which we're going to functionally see carryover into other hip hinge movements. Remember, it's a hip hinge, not a back extension. So ribs down, get the hinge from the hip, okay? Let the big muscles work so that you can take a lot of pressure off the back. You can be stronger through the back, stronger through the hamstrings, perform better, feel better, and you won't have to worry about blowing out your back then in the future. So, guys, this is Dr. Tansini. That's the good morning. Use that in training. We can use that in rehab as a way to build resilience and help someone get back into action. So, guys, remember, subscribe to the channel. I'm Dr. Tansini, Dr. Tank. This is your daily body armor. We'll see you next time.